One other piece, though, that goes back to Melinda's course of study and education is that I find it fascinating that there's virtually no course of study in nursing school or in medical school that trains them to negotiate or deal with conflict.
And it's pretty easy for those of us who are lawyers now to suggest they should have been doing that. But the rest of the world would have wondered why for 190 years we lawyers didn't do that, right?
That's right.
I mean, you know, so maybe it's just now getting there, and maybe the next wave of this is to say, yeah, how should that curriculum be changed so that in fact one of the skills they come out of school with, physicians, nurses, whatever, is the skill of managing difficult moments. You know, conflict may be a little harsh because people have a hard time admitting that. But a phrase like difficult moments is not too harsh. They're going to have those all day long, every single day. We do have some ability to help them be more effective with them.
Yes.
And whether that's in their schooling or that's in continuing professional education, lots of different places it can come in, but I think it's a field that is going to need it.
A next frontier in many ways.
I think so. Much more complex. And the thing we're doing that I find quite exciting this year is that so many people, a number of people have now looked at the medical field and said, that's where I want to go. And they're wonderful people with great skills, but typically they're going in with a product or one idea. And they're saying, you know, if you will do this in your hospital, or if you will buy this service or whatever. Our approach this year, working with one of the largest hospital corporations in the country, is to say, would you give us the opportunity to take the entire institution? And could we take that as a professional culture? And could we kind of go anywhere we want to go to help you decrease these difficult moments? And this company has said that that approach sounds far more interesting to them than buying this video or taking this training or whatever. And so we're going to look at a hospital in California, one in Texas, and one in Florida over the next few months. And literally be able to look at every aspect of the institution and then provide back to them our assessment, but then a menu of things we think they might do so that comprehensively we manage this as opposed to just picking out a piece or two here or there.